Good afternoon, ladies and gentlemen. My name is Mina. I'm a food safety specialist, a nutritionist, and as well as an health and safety specialist. Welcome to Mina Safeti, a platform that I have dedicated to regularly update you on food safety, health issues, diseases, and diet management. In this episode of Mina Safeti, I would like to touch on food poisoning, a very important aspect of food safety that severely affects our well-being. According to WHO, almost 1 in 10 people in the world fall ill after eating contaminated food, and 420,000 die every year. This is very, very alarming. This shouldn't be the case, since as human beings we are entitled to wholesome food for our survival. Today, I would like to go more or throw more light into food poisoning to give a fair idea of what food poisoning is, the management, the diagnosis, how to avoid, the first aid measures. Yes, details but brief informations on food poisoning. Someone may ask, what is food poisoning? How do you get it? How would you tell this is food poisoning? So when you talk about food poisoning, it's actually an infection of the digestive tract that you obtain or you get through foods and drinks, or better still, contaminated foods and drinks. There are different types of food poisoning. It ranges from mild to deadly severe. An example or some examples are E. coli, which causes a lot of severe cases that needs to be admitted before they can be treated. Vibrio cholera, typhoid, salmonella, staphylococcus, botulism, shigellosis, viral hepatitis. Yes, so you ask yourself, where are the sources, or what are the sources of these food poisoning? The very, very important sources that you should pay critical attention to are raw meat, raw vegetables. The others are sports dairy products, your waste at home, and when you have a poor personal hygiene, it's another source of food poisoning. So let me throw more light on this. When you talk about raw vegetables, these are vegetables that have been taken care of by fertilizer, and these fertilizers sometimes are human waste, so they come with their own bacteria, germs and all naturally. So when you get them from the market, the first thing you have to do, whether you will be cooking it or preparing it as salad or fresh or however, the first point or the first important thing you have to do is to make sure they are well washed. And to wash them very well is to use vinegar or saline water, that's a mixture of salt and water. Wash them. In fact, it's best to dip them in water for a while before you wash them, and rinse them. That way you have reduced the viral load or the bacterial load on them to a minimal load that when consumed cannot cause harm. Yes, meat is another very important source of food poisoning. You have to wash them well as well and cook them thoroughly so that every germ in it can die off. Any sports dairy or dairy products like milk, egg are not supposed to be consumed at all. Disposal is the best, because these products will have toxins already produced in it by these germs. So when they are consumed, it causes a lot of harm. Your waste at home, you have to find a way to manage it, protecting or cover it and dispose it regularly, because when these waste deteriorate, they breed germs, and when these germs are bred, they now spread out in the kitchen, in the air, contaminate the air, and then goes to deposit on your food, and that is where food poisoning starts from. Your personal hygiene, very important, because when you are dealing with food, you have to keep a very clean hand in handling these foods. You have to keep your nails short, cover your hair with a net. You have to reduce your communication when handling food. You have to wear a clean dress, Everything will have to be neat when you are dealing with food, because food is going to be taken inside the body and needs to be well taken care of before consumption. These are the very important points I would like you to note on the sources of food poisoning. Let's go now into how does or do these germs react? How do they form or cause food poisoning? So these germs goes into the food and multiply, and when they multiply they produce toxins, and these toxins are very heat stable. Sometimes after the germs has produced toxins into your food, what happens is they cannot be removed even after you heat it for a while. They are very heat stable. So the best thing to do is to dispose of the food. Yes, dispose of. Other than that, what the toxins do is they react with the walls of your stomach and cause your stomach to bleed, have diarrhea, stomach cramp, and you have the urge of vomiting. And when this happens for a long time, you are at risk of severe dehydration. Vomiting and having running stomach at the same time is very, very dangerous. Very, very dangerous. So it's best you take care of it right from the onset. So someone may ask, what are some of the manifestations in humans? How does it show that you have food poisoning? The first important thing is you start having stomach cramps. Followed by stomach cramps, you start having running stomach. You still see blood stains in it. Some people don't have blood stains in it, but running stomach is very common. Abdominal pains, you have fever, weakness, and all that. These are the signs in the adult. Now let's look at the signs or the manifestations in infants. For children, they don't talk. So the best they can do is to cry to express their emotions. So you see that your child begins to cry when you touch the stomach, it's painful. The child refuses to eat. The child will vomit or throw up, and the temperature goes higher than 38 degrees. As soon as this signs happens simultaneously in an infant, you have to quickly report him or her to the hospital to get attention, and you should suspect food poisoning. Manifestation in pets is also the same as vomiting. The pet looks dull, feels dull, does not move. The pet has an urge of drinking more water, refuses to eat, lacks coordination, seizures, and collapses eventually. So there are effects of food poisoning. Some may be acute, which is the same as short-term effect, or chronic, or same as long-term effect. Some of the acute or short-term effects are severe dehydration and weakness. As soon as you are diagnosed of food poisoning, you realize that you begin to have the urge to drink a lot of water because you are getting dehydrated. You feel a weird weakness in your body. And then the long-term effects are also brain damage, your nerve, chronic arthritis, you can get kidney failure. These are the long-term effects, and that's why it's good to reduce your chances of getting food poisoning, or even avoid it at all completely, because when you get it, you are leaving a long-term effect in your body, and this is very, very severe. Yes, so these are the long and the short-term effects of food poisoning. What are the effects in pregnant women? For pregnant women, as soon as you are exposed to food poisoning, what happens is you are at risk of premature birth, miscarriage, or stillbirth, which is very, very bad. Effects in children: there's retarded brain development, causes retarded growth, and all sorts of complications in the child, because these children are now growing, they are developing their systems, their brains, their body organs. So when these infections such as food poisoning come to interact in their development, there's poor development. Sometimes retarded growth is very, very bad, because the child grows and cannot fully develop his potentials. So let's now come to how do you prevent this food poisoning. Like I said, food poisoning, the very important and first step is to practice proper hand washing, proper personal hygiene. Keep your environment neat. Don't keep pile waste in the kitchen, or if you are in a manufacturing industry, don't pile waste. When there's time for it to be disposed, it is postponed, and then it begins to breed bacteria and all, and it's pressed in the air, contaminate the air. This is a very important point and a very, very important source of food poisoning. So dispose your waste regularly. Wash your hands when you're handling food. Keep personal hygiene. Cover your hair with net. Keep your fingernails short. Keep a clean cloth when dealing with foods. If you are served food and you are not ready to eat, for example, you go for a party and then you realize that the food has kept more than 2 hours, as soon as you are served, request that you want it heated. But when it comes to salad and mixed foods and rich food, these are high risk food. So I personally will advise this high risk food can be totally or completely avoided, just to reduce your risk of food poisoning, because as soon as it gets into your stomach, it gets hold of it, and if you don't take care, it can cost you your life. So you cannot compare a salad or a portion of salad bowl that you eat at a party to the cost of money you spend at the hospital if you are diagnosed of food poisoning, the admission, the time you are going to spend there to recover and all that. So please, let's take note of this. Okay, another advice I'll give is when you are handling your foods at home, especially when you are storing them in your storeroom or your freezers, these vegetables are from the farms and they have germs already because of the the manure, the fertilizer they use to grow them. So when you bring them home, you should know that they are coming with germs and bacteria. So the best to do is to wash them slightly, at least with some saline water. Like I said, it's the same as salt water. Wash them slightly, then you keep them in a place where you always keep those kind of items. Then when you are dealing with partially ready to eat foods, these are food that you don't really need to put them on fire before you eat, like sardines, corned beef, or maybe something that when cooking doesn't keep too long on fire. You should separate them totally from these foods. Also, your raw meat, your fish has to be separated in a different environment. If you are storing all these things in the freezer, make sure your freezer is well demarcated and separated from each other, that there will be no cross contamination. You are storing your ice cream, your yogurt, your toffees, your cakes, it has to be totally far away from your fish, your meat, your raw eggs, your yam, your plantain, because these are sources of germs, and when they go into your cake, your milk, your butter, your ready to eat foods, you don't heat them. Okay, and so what happens is you eat them straight into the stomach, and that can cause you food poisoning. It's best to separate them differently. Yes, so also avoid pests at home. Pests like cockroaches, rodents, wall geckos, these are carrying agents. They carry these germs and deposit onto your food. As soon as they settle on your food, know that they've deposited germs, and these germs take a very short time to multiply, and when they multiply, that is it. They begin to produce their toxins, and these toxins now go a long way to affect us. So what's the management for food poisoning? The first thing you should do if you are suspecting food poisoning is to drink enough water, because what water does is it helps flush out all toxins from the stomach and avoid dehydration. If you don't drink water, you continue to vomit, eventually become dehydrated. Yes, which is very bad. Dehydration can cause trauma and quickly you can collapse, and that is it. Yes, so drink enough water to sustain you until you go to the hospital. When you go to the hospital, doctors or nurses will start giving you treatment on antibiotics, either oral. If your case is not too severe, they will give it to you to go home, but if it is severe, they may retain you and give you infusion to quickly do away with these toxins. Yes, so during the treatment of food poisoning, you're going to be subjected to antibiotics. So some of these antibiotics react with certain foods like dairy product, milk and egg, or carbonated drinks. So you don't have to take these things when you are on treatment or under treatment with these antibiotics. You also have to avoid too much pepper. Like I said, carbonated drinks is not the best at all because it irritates the stomach already. Because food poisoning is when you are diagnosed of it after during the treatment, you see that your stomach is irritated, you feel the pain, you realize that you are not comfortable. So avoid carbonated drink because itself it irritates the walls of the stomach. So you avoid it. You avoid taking too much pepper, like I said. Yes, and also during the treatment, drink enough soup, of course with less pepper. Drink enough water, enough fruit juice. Reduce your intake of dry foods. Make sure your food is soft and then can give you more water. Foods that are full of water. Eat nutritiously. Eat a little at a time. Too much of food during this treatment will make you feel very uncomfortable and you might easily throw up. So rest enough, and if you feel like throwing up or passing out stools, it's very natural because these are the ways that the body gets rid of the toxin. The natural way it gets rid of the toxin. So if you feel like vomiting, continue. If you feel like passing stool, continue until the drug begin to work on you. All these things will stop. Yes, so one important thing too that people do not know is the fact that when you are taking drugs to treat food poisoning, you should know that there's a required dose. That's why then when they give you a prescription at the hospital, they say take 3 times daily for 7 days, take 2 times daily for 5 days. What it means is within the 5 days, the minimum requirement they have given you per day, you need this dose for the number of days to be able to kill or reduce drastically the viral load or the bacterial load within your body. So if you take 1 day, 2 days, 3 days and you feel better and you think you are fine, what happens is the remaining bacteria that didn't die will multiply and next time become more resistant to the antibiotic you were treated on. So your case again becomes severe and there's reoccurrence of infection. But if you are able to complete your medication as indicated or stated by the doctor, what happens is you are fully healed and you reduce subsequent infections. Yes. So in conclusion of what I want to what I have discussed is food poisoning is costly. Trust me, when you begin to fall sick of food poisoning, the amount of money you'll be spending at the hospital to make sure you recover your health fully is incredible. So avoiding food poisoning right from home, right from wherever you find yourself, cannot be compared to the cost you spend at the hospital. It can cost your life. I have friends back in the university, they've gone somewhere, ate salad, came home within 2 hours, started having stomach cramps. The next time they are diagnosed of food poisoning and I hear he or she is dead. It has happened several times. Buying food outside late, close to gutters. You see that the gutter is not closed and you are buying salad close to the gutter. You are buying porridge close to the gutter. You are buying wache close to the gutter. There's an open drainage. What happens is when air blows, it goes to deposit onto the food. It is not advisable. Make sure when you are buying your food, you look at the environment, how it looks like. The personal hygiene of the person selling the food is also very important. So let's take note of all this. Also, I would like to say we should pay attention to our children when we are breastfeeding them. If you are breastfeeding straight from your breast, the nipples are already self-sanitized, okay? So you don't have an issue with infections. No matter how dirty you are when you are feeding your child, the nipples are sanitized. Naturally, God has done it that way. But if you begin to pump breast milk into a bottle, you have to know that you are at risk of severe contamination. So what happens is, for breast milk pumping, you have to boil the containers or the feeding bottles very, very well. Boil them with clean water at a certain temperature. I will say 1 hour is fine. and the fire will have to be a bit high to be able to kill any germ. You boil them. After boiling, then you wash your hands. If possible, you can wear gloves or wash your hand properly. Then you bath, so that when you are expelling the milk, you don't add sweat, because sweat is a source of germ to the milk. And then you take your time, you pump the breast milk, make sure it comes well. You finish quickly. As soon as you remove it from the mouth or the nipples, you cover the container, cover it completely, and go and put it quickly into the fridge to be able to keep the temperature very cool, to avoid breeding of bacteria, because of course nature has bacteria. There's no way there will be no bacteria in the breast milk, but at least we want to maintain a certain amount or load of bacteria that will not cause harm or produce toxin. So as soon as you are done, send it to the fridge, because what temperature does is it reduces or makes the environment uncomfortable for germs to breed. Yes, it makes it uncomfortable for germs to breed. So when you keep your foods in the fridge, what happens is it reduces the chance of it reproducing or breeding and producing toxin. So let's take note of that. When you are eating your food, make sure you eat hot foods all the time. Don't leave your food without keeping in the fridge for a long time. If you are ready to eat, you eat. If you are not ready to eat, make sure it's in the fridge. When you are ready to go and eat, even when it's in the fridge, you still have to heat it before you eat. Yes, because even at cold temperatures, there are some germs that can still survive. Just like how some germs can survive at high temperatures, at cold temperatures, some germs survive. So there are different types of germs that survive in cold temperature, hot temperature, in salt water. So, it's a whole lot. So the best is to make sure that you heat your food well, you keep it within a reasonable time, and all that. Yes. So this is a little app for you, and this is my first ever audio on food poisoning. I believe that the little I have said has given an idea of what food poisoning is. How do you manage it? What are the symptoms? How do you prevent it? And what do you do when you have it? Thank you, and expect more episodes on different topics that affect our life daily. And I believe here I'm going to really do my best to give you the best authentic information on, like I said, food safety, diet management, diseases, and then basically all that. Yes, thank you very much for your time, for listening. Stay healthy, stay safe, stay long. Mina Safeti, live long. Thank you.